watching. So how many of us, we've all done this a billion times. We wake up and we hit our snooze, probably for the third time. Because being as college students, we don't want to wake up, especially at the crack of dawn. But how many of you guys naturally know someone who wakes up at the crack of dawn, or even earlier, 5, 4 o'clock? I know one person who does that. He wakes up at 5 o'clock to start his day. What he decides to do is he runs to the nearest gym, which is about 30 minutes away. Who does that? Come on, 30 minutes just running there? And when he gets to the gym, he takes 2 hours to do cardio, some strength training, and if on a special day, he'll do some CrossFit. After this early morning, he runs home as a cooling off process. Yes, I know you're all thinking, this guy must be crazy to put that much effort in exercise. But in all honesty, this guy does this routine every day and has done it for over 10 years. The guy I'm referring to is probably the healthiest and strongest person I know. He keeps his body in tip-top shape and sometimes is referred to as a bodybuilder. Well, on March 1st, 2013, his routine was about to change drastically. My brother Michael was diagnosed with lung cancer a few weeks before his 27th birthday. Being the healthiest you can be still does not prevent you from getting cancer. Dr. Deborah Davis, director of the Cancer Center at the University of Pittsburgh Cancer Institute, states, aside from smoking, drinking, other bad habits, and some workplace exposures, most cancers occur in people who have led healthier lives. So in order for you to understand how my brother Michael felt when going through both radiation and chemotherapy, I will discuss the side effects of cancer treatments has on the blood cells during treatment. First, I am going to start off with a video. It just talks about that cancer is difficult to go through, but what's even more difficult is the treatments because it takes a lot out of you.
Doctor, what are your thoughts on conventional cancer treatments? When we talked a little bit about chemotherapy, radiation, surgery. You already said that chemo doesn't work as much as most people might think.
It's overused, most definitely. Chemo, radiation, and surgery have their merits. Ask Lance Armstrong, who was cured of advanced testicular cancer using chemotherapy, and he has now raised almost $500 million for cancer research. Wonderful. I think he's not only a phenomenal athlete, but a great humanitarian. However, as I said, chemotherapy only works in about 3% of all cancers, mostly childhood leukemias, some lymphomas, and testicular cancer. But it's used in so many other cancers where it's ineffective and in many cases counterproductive. I've seen many patients who come to me with
So we're going to talk about the damages to the blood cells. Cancer treatment has side effects to the blood cells. It can cause anemia, it can cause fatigue and pain, and it also has a better chance of you getting infections. According to the survey you all participated in, most of you know someone who was diagnosed with a type of cancer, and majority of them were in great shape and great health. Professor Simon Rule, globally renowned expert and researcher at Plymouth University Peninsula Schools of Medicine and Dentistry, states, the thing about these new drugs is that they will eventually be able to reduce side effects to the treatment. They go through chemo, radiation, but they're so miserable after all of that that they can't enjoy their life. They have to go months and months and months of being tortured and going through whether they're going to live or whether they're going to die. The first side effect, this is my brother, Michael. He's 28 now. This is before he was diagnosed and after. As you can tell, he lost his hair. He lost a lot of weight, especially for his size. and it only took him about 4 months to lose all that, and it took him about 10 years to gain all that. The first side effect is anemia. It can be caused by cancer itself. It can be caused by radiation and chemotherapy, which my brother had to go through both at the same time. The red blood cells also can be damaged and destroyed by the body, and if it's not replaced, that's what happens. You get anemia, and then you have to be on more drugs than already prescribed to you. Eli Jones, author of the 2003 book Cancer, Its Cases, Symptoms, and Treatments, he stated that vaccination, meat eating, tea, coffee, and alcoholic stimulants are all causes of cancer. At our age, between 18 and 23, we have come to know that everything causes cancer. 2 minutes in the sun, our cell phones, maybe staring at a computer screen for too long. The second stage is fatigue and pain. How many of us have been super, super tired where we can't keep our eyes open? Exactly. But to a point of physically, mentally, and emotionally draining, what we do is we want to take a nap. And after the nap, we feel rejuvenated and ready for the rest of the day. But for people that are going through chemo and radiation, they can't do that. If they take a nap, they wake up and they're still tired. They can walk to the bathroom and walk back and be completely exhausted after that. They have no energy whatsoever, and it pretty much ruins their day. This kind of fatigue can cause a lot more pain. They get sick, and it can cause depression because they can't do anything besides sleep all day. With pain and cancer, this is caused by tumors, can be placed on your nerve, can be pushing on your nerve, so they're very unhappy with it, or it can be in your bone or your body's organ. Cancer treatments such as chemotherapy is very painful because their port is either on their chest or on their side, and it's pretty much you're getting pumped full of chemicals that are just killing your body. Along with radiation, you can have a bunch of more side effects with that because wherever the part it's killing, it's attacking you. And along with surgery, obviously, it will have pain. My brother Michael, 28, stated, my morning routine went from 3 hours of exercise to 5 hours of chemo and radiation treatments. He felt hopeless. He felt like the new bubble boy. Because of my brother's size and health, his chemo dosage was doubled the amount of an average male would, who only exercised a couple times a week. The third side effect is infections. The normal amount of white blood cells we have is between 4 to 11,000. With an infection, it can drop to 1,000 or less. With this, we can get fevers, and if it reaches up to over 100 degrees, they have to go to the ER. This is very, very important that they pay attention to because if they get sick, it can be very, very life-threatening. And that's a side effect to being in chemo or in radiation. Both can affect your immune system. It can even damage it to a point of you're always sick all the time. The most commonly diagnosed cancer worldwide was lung cancer. 13% of all cancers diagnosed out of 1.8 million. My brother and my grandfather, both in the best shape. My grandfather's 85, skis, snowboards, runs, jogs, diagnosed with lung cancer. And they both were in that 13%. Unfortunately for my grandfather, he didn't make it, but my brother did. You can try and prevent being diagnosed with cancer. You can take precautions, like staying out of the sun for long periods of time, not smoking, and staying away from people who do smoke, because inhaling smoke is just as bad. All we can do is just to go to frequent checkups, make sure that we're in the tip-top shape. Just try to keep ourselves as healthy as possible. My brother went from being strong to weak, and now he's the strongest person I know, because he fought and he never gave up. Today he celebrates 8 months in remission. He might have lived an unhealthy fight, but only for a healthier life. Thank you.